This meeting is being recorded.
Hello, everybody. It's Mike, 55 years young, and I am back with another monthly interview with Dr. Peter Rodgers with a really important topic today. Dr. Rodgers, if you don't know him, he's a Stanford graduate. He is actually practicing medicine as a radiologist, so he sees all the images. He knows what's going on out there. And I believe also, Dr. Rodgers, am I correct that you've authored at least 20 books? Is that right?
Yeah, more than that.
More than that. Okay. All right. Well, we got a really important topic today. I'm indoors in the studio today. Usually I'm outdoors when we're recording, but not today. And I just finished eating dinner and it was no salt added. I even added some hot sauce today, no salt added. But, you know, salt to me is added salt. That's what I'm talking about, is kind of right up there with high fat foods in terms of what the average Joe or Jane is doing unknowingly to harm their health. So, to start off, do you think there'll ever be a day when the average person will not want to add salt to their food?
No, I don't really think there's much hope for the average person. There's only hope for the few rare motivated people that sort of seek out information like this. The average patient's a disaster, a train wreck, a crash and burn. They're really sort of ignorant, lazy, and stupid. They think their doctor's supposed to save them. Their doctor doesn't know what to do. Just keeps selling them drugs and then sends them for surgery. That's the way it goes for most people. They don't age well.
That's right. And I guess one of the reasons why I see that, and I agree with what you're saying, I look at it from a different angle. I just kind of see how there's all the foods that everybody's eating. You go anywhere, you leave your house, it's high fat and high salt, added salt, right? Like I put some hot sauce on my dinner tonight, but I made sure I got one with no added salt. It's nearly impossible to find. So let's get into added salt. Now, obviously, from my point of view, since I'm out there, we create events, and all the foods that we have zero added salt as part of our requirements, and we see a reason for that. But a lot of people don't see a reason for that. Can you give a quick summary as to why somebody would do better to avoid foods with added salt?
Well, I think what happens is most people have very low standards of health, and they have very low standards of cognitive function. So they're like, hey, things are okay. Like the way they judge their health, I'm doing okay. I'm not as fat as my cousin. They have low goals. And if you have low goals, you don't notice your cognitive function is down unless you challenge your cognitive function until you've gone down quite a bit. You don't notice your physical fitness has gone down unless you challenge it routinely and you can sense a small change. Like I always go upstairs. Like I have to go up 10 flights of stairs. I carry 20 pounds worth of books when I'm doing it in my backpack. So if my energy goes off, I know it pretty fast. Yeah. Whereas most people, I think, they don't realize how deteriorated their health is until they've got something, irreversible or near irreversible. So they don't catch it till it's too late is what I'm basically saying. And that's why I don't really think there's any hope for them. Because, I mean, the majority of patients I see are train wrecks. There's really no hope for them. And that's because they're not willing to do anything. They expect the doctor and the system to do everything. But the reality is the doctor and the system don't know how to do anything that's useful. They can give them a bunch of drugs that don't work. They can give them a surgery that works a little bit. But if you want to prevent problems, you have to start thinking simple. Every organ in your body, it functions better if it has good blood flow. So then the next question is, well, how do I get good blood flow? Good blood flow comes from a low-fat, low-salt diet. No oil, okay? That's the basics. If you want your muscles to work better, that's the basics. You want your brains to work better, that's the basics. And then it gets more complicated in the modern world. You must also avoid toxins to the extent you can. So then you need to learn what toxins are. And so that's kind of how that all goes.
Okay, well, just to kind of get people up to speed on how we got into this situation, I will have a conversation occasionally with people and I'll tell them my theory, okay, as to how we got into this spot that we're in with added salt. Now, I believe we're in a time when humans can thrive if we choose to act that way. Like you said, most people are not going to, they're not open-minded, or they lack the knowledge or some combination of that. But I think that we got here with the added salt due to trying to survive as humans. Because I think back in the day, I wasn't there. There wasn't reliable transportation. There wasn't plug-in refrigerators and freezers, right? I mean, if you were in a place that got cold in the winter, short of hunting, how are you going to preserve your plant foods and things? Well, I guess the only way was to add salt, right? So that's kind of how I think we got here. And that was a survival mode, right? You had to do that. A lot of the humans wouldn't have survived without that salt. So I understand why we brought it in. And it's just the hard part is trying to convince people, hey, we're in 2025 now. We don't need to do that anymore, right? Right. I mean, in fact, it's harmful, like you're saying, right? So not only do we not need it, but it's harmful. What do you think about that as a theory as to how we got here? I'm
Well,
curious.
yeah, I mean, I think in real foods, salt's relatively scarce. Like you look at plant foods, you look at fruits, fruits pretty routinely have 300 times more potassium than sodium. But you eat a processed food, they typically have about 5 times as much sodium as potassium. They're the opposite. Processed foods are the opposite of normal foods. So I think that salt tastes good, and we seek salt because in our natural ancestral environment, it was relatively scarce. Our kidney is
We had to
designed.
have it. Do you think we had to have it in our ancestral environment? Do you think, like I said, in order to have enough food to make it through the winter, they had to have preserved it in advance with salt?
Well, right, yeah, it was useful for preservatives. It tastes good, so there's a reason why we seek it out. A salary, the old Roman word, was to be paid in your salt. All those sorts of things. But it's just that now it's just so abundant. The main source is processed food. So the first step to avoiding salt is to avoid processed food. And the other thing.
You mentioned plants are low salt. So is it true, because this is what I tell people, that all whole plants already have some level of sodium in it? Is that true?
They all have at least a little bit. And you only need a very minute amount. I think we're designed to eat 20 times as much potassium as we do sodium. At a minimum, 5 times as much potassium as sodium. And if you eat a plant-based diet, that's whole food, single ingredient, that's what you will get. But if you eat processed food, you won't get that. If you eat processed food, you'll end up, probably with more sodium than potassium, which is a disaster for your physiology. It messes up all your plasma membrane pumps, every cell in your body.
Okay, so that point of balance or imbalance is really the key factor here. It sounds like you want to make sure you've got that sodium potassium ratio correct. I know probably most people watching this, unless they're familiar with you, Dr. Rodgers, maybe have never heard that before. But what do you do? How do you know when you've got the right balance there with sodium and potassium?
You can look at a nutrient label. In general, fruits have about 100 to 500 times more potassium than sodium. So if you're eating a lot of fruits, you're getting plenty of potassium. Starches are about typically anywhere from 15 to 50 times as much potassium as sodium. So if you're eating whole food starches, you're doing pretty good. Veggies are not so great. Let's say veggies are about 5 to 20 times more potassium than sodium. And so meat is about 4 times more potassium than sodium because it's still a real food.
Okay.
The reason why all living foods, animals or even meat, have higher potassium than sodium is because imagine that the first cell started in the ocean, made by God. Okay. So what do you need to do to make a cell? You start out with salt water, and out in the water from the ocean, there's lots of salt and there's lots of calcium. So in order to create a living cell, you have to have the same number of particles inside as outside. Otherwise, you'd have osmotic swelling. So you have to pump out the sodium and the calcium. And in place of that, you bring potassium in. That's the main thing to kind of know. So all living things are high intracellular in potassium. So if you're eating something that was alive, like a plant, or to a lesser extent, an animal, it's going to be higher in potassium than sodium. But a processed food doesn't have to follow any of those rules. A processed food, they grind the thing up, and they throw lots of salt on it. So processed foods tend to be way high in sodium. They're not good for us.
Okay, so sounds like nature has it figured out, all right, in general with this balance. And the minute we start messing with nature, in almost all the cases, like the processed foods, we do it wrong. Is that a good summary of that?
Yeah, because it helps to look at your kidney. I spent a while trying to understand the kidney. The kidney is designed to excrete potassium. It's made to excrete thousands of milligrams of potassium every day. It's made to hang on to sodium. Okay, that's what it's designed to do. That's our nature. There's these people like the Yanomamo in the South American jungle. They would test their urine and they couldn't find any sodium in it, next to none. Some of them 0 sodium. And that's because they don't add any salt to their food. By the way, they don't get any high blood pressure. You check the blood pressure on a 70-year-old, it'll be like 105 over 70 or something, or 60.
Okay, Dr. Rodgers, what you mentioned about the kidneys, you say they are designed to hold on. So if you put excess sodium, like the more and more sodium you put in your body, processed foods, or isolate of salt sprinkled on everything, your kidneys are going to keep working and keep working to hold on to that?
Well, you're going to excrete some of that, but it's not as natural for the kidney to excrete sodium as it is for potassium. It's expecting a high potassium load and a small sodium load. So when you give it something else, it takes it a while before it can get out of your system. And if you keep eating that way every day, it's hard for your kidney to catch up with it. And then you have these plasma membrane ion gradients on every single cell of your body. And they're also made for a high potassium diet. When you start eating these high sodium diets, you dissipate those gradients, meaning that you get too much sodium inside your cells. And then you have a less of a ratio between intra and extracellular. Normally, it's very high. Like I made a personality metaphor for ions, okay? I say that potassium and magnesium are like the working class, the good working class. They're doing their labor to make the cell function. Sodium is like the angry poor. It wants to break into the cell is the city. And so it wants to bust down the walls and get into that city. All right. And I said that calcium is like a stuck-up aristocrat, a bossy wife. Okay. It just wants to insist on whatever needs to be done. It doesn't care about being reasonable. The reason I mention all of that is that potassium is like flipping on a light switch in a cell. When a potassium comes in, I'm sorry, I meant calcium. When calcium is the aristocrat, calcium is the bossy wife. When calcium comes in, it just insists that the cell do whatever the cell does. So if you're a pancreas beta cell, you release insulin. If you're a muscle cell, you contract. Okay. And then you got to get that calcium out as fast as possible because otherwise the cell will not be able to turn itself off. And that's based on, let's say, a spinning, like a rotating wheel, revolving door where sodium comes into the cell and the calcium is pumped out. So sodium always wants to get into the cell. That's the important thing, That's why I call it the angry poor trying to bust into the city. And what I'm saying here is if you chronically eat these high sodium diets, you start accumulating too much sodium inside the cell. And then the gradient to bring it in is not as strong as it used to be, which decreases your ability to couple that to pumping out calcium. So you end up with high intracellular calcium and you have overactivated cells for whatever they do. If it's vascular smooth muscle, they're chronically contracted. And that's going to drive up your blood pressure. You don't want that. It messes everything up. It makes your brain hyperexcitable.
Okay. Now, is it true that if you're eating too much salt, aka added salt in your foods, processed foods, that your body's going to keep trying to hold on to that sodium? It's not going to want to let it go?
It's going to try to excrete it, but it's just not that good at excreting sodium. It takes time.
I see.
Yeah, so the thing to do would be to eat as much plants as possible to start compensating for that sodium. Like, eat more fruits, because what really matters more than the total amount of sodium is what's called the K factor, the ratio of potassium to sodium. So if you increase your K factor by eating more, fruits and starches, then you'll have more potassium relative to sodium, and that'll help you to maintain your plasma membrane gradients, because every cell in your body, its function is based on that.
Right. Okay. Now, let me ask you another question. Is this a caveat? And this is not the average Joe and Jane. Let's say somebody's an exceptional or an extreme athlete and they're sweating all the time. Would they have a different balance there? Is the sodium come out in their sweat?
Yeah, you lose some sodium in your sweat, but it's a little bit variable. Your sweat glands are kind of like little kidneys. So if you're low in sodium, they will conserve more of it. But it can be helpful that they get a little more salt. Somebody, let's say, who's running a couple miles on a hot sunny day, they can handle more sodium being taken in. And I would say, for somebody the key thing I'd say is make sure you're eating your plant foods, because then you're going to get more potassium to compensate for it. And you don't gain anything by eating the sodium. So I would say, why bother with it? I realize, though, some people, that's the only way you can get them to eat the plant food. They're much better off. The sodium is a problem, but it's not as big a problem as the dietary fat. So I would let them have a little bit of salt if they insist on it, rather than that they don't eat the plant foods. But if you want to optimize things, and my attitude is for most middle-aged Americans and older, they've got real problems, and they need to try to reverse them as best they can. So it'd be wise to try to avoid everything. I sort of think that, most people, they give you an attitude when you talk about health. They're like, well, I'm doing okay. Why should I have to do that? And my attitude is more like remember Animal House, Flounder? when they tried to get him to join the fraternity. He finally said, I'll do it. I think the proper response is to say, all I have to do is eat these plant foods with no oil, and I don't have to become fat, sick, and stupid like the vast majority of Americans. I got my internal medicine doctor friends. They tell me every single one of their patients over 60 is cognitively slow. That's the real frequent disease that nobody's talking about. I'll see 10, 15 demented patients in a day. There are tons and tons of people that are cognitively impaired, and it's not widely talked about. And these a lot of times will be old people who can sort of find their way home, but they've really lost all their nuance for their vitality, their creative thought. They've lost their motivation, their energy, and so they're just sort of waiting around to die. You don't want to end up like that.
No. So the sodium, the eating too much salt, it happens over time. It's not like, oh, I just had one bad meal, I'll stop, I'll have less. I mean, this is slowly building up over time, as you're describing, right? And it's affecting people in a chronic way where they just can't shake it immediately. It needs to be, you need to have a whole new balance that you're eating, the plant foods, right? Because when you describe the plants, you're describing whole plants as found in nature. And I think that's interesting because nature must have had that figured out already, right? I mean, the way you're describing it.
Oh, yeah. Nature's plant foods, they're made for us. It goes all the way back to the Bible, the first chapter, Genesis 1:29. Every plant is put on the earth to be your food. That's what we're designed for under ideal conditions. And so it's sort of like what I think more people should be doing is, trying to seek the ideal, but it's hard to get people to think that way. Most don't think that way.
Yeah. Okay. You mentioned high blood pressure. So to me, that's what I think of when I hear about added salt in food. It's going to spike your blood pressure. Now, along that lines, one of the things we've talked about in past interviews is miso, which is a fermented sodium. Some people claim that I'm not saying it's anything better than this claim, if this claim is even true. Added salt has many bad problems, as you're describing. One of them is high blood pressure. They're saying that if you do eat fermented salt, it will not raise your blood pressure. Is there any truth to that?
I think miso's terrible food. I would never eat it. Okay, number one, it comes from soy. Soy is routinely GMO, processed like with hexane. It's really high in fat. It's very estrogenic. Everybody tries to say it's not estrogenic. I've read the original papers. It's very estrogenic. Okay, it causes premature puberty. It causes lowered sperm counts. I actually think it's subsidized trying to sterilize the proles. Okay, I think soy is a terrible food. Okay, and it gets worse than that. Miso is very high in sodium, something like 640 milligrams per tablespoon, something like that. It's very high in sodium. It also often has MSG in it, monosodium glutamate. So monosodium glutamate is a brain toxin, a brain excitotoxin. All right, so it's also high in sodium. It comes from soy, which might be processed with hexane, another brain toxin. Soy is an estrogenic, reproductive toxin. Why would I ever want that? No way, it's crap.
Yeah. I mean, I agree. I just see a lot of people. This is why I bring it up from time to time in the health space, saying, "Oh, well, we're doing so much better than added salt. We're just having some miso and mixing it in." Because, like you said, they're looking for that taste on the taste buds, but it's still going to have so many negative health effects. Even if one of them isn't there, that's only a claim. That's not going to raise your blood pressure. All the other negative effects of eating added salt are there, and then in addition, like you say, some additional ones. So I just wanted to bring it up to make sure that people know that it's probably not a good choice, it sounds like, to do that. Now, what about the opposite extreme? Because I hear some people say, well, I have low blood pressure, so my physician is telling me to have more added salt. What's the case there?
Well, it depends. It depends on how you feel. If you're lightheaded, you feel like you're going to fall over, then your blood pressure is low. But if your blood pressure is just a low number, but you feel good, then that's your blood pressure.
Mm-hmm. So it depends. Would that maybe be a valid thing for someone to do?
If they're symptomatic and they've got there are some symptoms where they could have postural hypotension, they could have salt metabolic problems, but all of that stuff is really, really rare. Super rare. In which case, they can go to some doctor that specializes in that, maybe a nephrologist or some doc who specializes in treating uncommon causes of hypertension, maybe a neurologist, whatever. But those are rare birds, okay? 99.5% of patients are all kind of the same. hypertensive, pre-diabetic or diabetic, with coronary artery disease, cerebral vascular disease, abdominal pressure syndrome. I see the same stuff all day long, every single day, over and over and over again.
Right.
It's only on the internet that I get all these rare diseases.
Yeah. Okay. And even so, let's say even somebody has that rare thing where they're, I don't know, getting lightheaded because their blood pressure is too low. Is it possible that the reason they're getting lightheaded is not because their blood pressure is too low, but because they're doing a number of other things wrong with their food and lifestyle? Could that create that situation?
I would have them get evaluated, go to a doctor, get their labs checked, get everything checked out, see if they really have anything or not. Maybe they do, maybe they don't. But there's a tendency people to see themselves as exceptions, and they're probably not. Okay. Most people, I'm telling you, it's the same stuff all day long, every day. You know, you don't have, I can look at a film and usually tell how old the patient is approximately. I can see how calcified their arteries are, how degenerated their spine is, how shrunken and atrophic their brain is. I can usually pretty accurately put them in about a 10, 15-year range.
All right, you mentioned spine. I don't think you and I have discussed this, but something I've seen in the last year, I don't even know if you're aware of this, but I just wanted to bring it up because it kind of supports what we're saying from a different angle. There was a guy, his name is Dr. Gooby. He is on YouTube now, and he quit. You know this guy? Okay, yeah. And I've watched some of his videos where, number one, he explained why he quit as a neurosurgeon, which operates on brains and backs, right? And then he went on to explain what happens with too much salt and what he would see in his patients, and how some of his patients, especially with the added salt, would never heal, even if he did a perfect surgery. Whereas others who gave up the added salt would heal on their own before he can even operate on them. So something you shook your head, you must be somewhat familiar. So can you explain or maybe elaborate a little bit on that correlation?
Yeah, I think it's kind of funny because I know exactly who Dr. Gooby is. I watched his video. It was a viral video. I don't know how many views it's got now, 16 million or something. Yeah, MIT neurosurgeon quits. Okay, yeah, and he did say that. He said he would sometimes have to delay a surgery for a couple of months. And he saw if the patients were eating a plant-based diet without added sodium, they were walking and not smoking cigarettes, they would often just get better on their own. And so he started to wonder, well, how much good was this surgery doing? And yeah, why not? If you can heal yourself with a healthy diet, why not do that rather than go into the operating room? And by the way, I've written two books on spine disease, and I'm the one who figured out the theory of ischemic spine disease. Meaning that there were some papers showing that lack of blood flow due to atherosclerosis of the abdominal aorta can cause degeneration of the disc in the lumbar spine. But I figured out it's way more than that. You have two vertebral bodies and you have a disc in between. And when you don't have enough blood flow to that disc, it'll fail. But when it starts to fail, you get abnormal motion. And then the spine has proprioceptors to sense that abnormal motion. And it tries to fix it by laying down bone spurs, which connect the two bones above and below. And then the disc above and below has abnormal increased stress because of the lack of function of the intervening disc. So then it has accelerated failure. And the process marches itself all the way up from the pelvis to the skull. Okay. The disc is alive. It runs on anaerobic glycolysis. It's not dead. And walking helps to enable it to get its glucose and to push out its waste products. Okay, and then there's other things that mess it up besides the ischemia. And by the way, it doesn't just cause bone spurs anteriorly. That's called DISH, diffuse idiopathic skeletal hyperostosis. It causes bone spurs of the posterior longitudinal ligament, ossification of the posterior longitudinal ligament, ossification in the posterior part of the spinal canal, the ligamentum flavum, ossification of the ligamentum flavum of the spinous processes. That's called Bostrop's disease. So it messes up the whole spine, is what I'm saying. And then it gets worse than that. If you've got glyphosate, that thing they spray on the non-organic soy and a bunch of other plants, they spray it on like 70 different plants. That's thought it means like glycine phosphate. Think of it as glycine, the smallest amino acid with a phosphate added onto it. That is thought, according to Stephanie Seneff, another MIT person, is thought to substitute for glycines in collagen. So it has a very small side chain, only a hydrogen, which it has to wrap as a triple helix. So in order to wrap something tight, it's nice to have small side chains. Well, she believes what's happening is the glyphosate is substituting itself for the glycine and getting into the collagen. And then it's having a hard time wrapping tight. So you weaken the ligaments of the spine, and then you're going to get more spinal segmental instability. And 2 VBs and their intervening disc is a segment. So eating the lousy diet, because I know that DISH, the bridging osteophytes of the spine, I see them on like almost every single patient. Okay, over 40, let's say, at least over 50, certainly, very much so. Whereas I didn't used to see him that much back when I was a resident in the 1990s. So what I'm saying is it's becoming more common. All right, and it gets worse than that. Skeletal fluorosis from fluoride in the tap water, that also causes damage to the collagen. It interferes with the hydrogen bonding, okay? So because of that, it weakens the ligament. Lack of vitamin C also weakens these ligaments. And all of these things are problems in a lot of the modern people. And then also ischemia. Ischemia is just the risk factors for atherosclerosis. If you had hypertension, diabetes, you smoke cigarettes, and all that stuff. So I see a lot of crappy looking spines. Okay, and then, once these things become irreversible, you're going to have back pain the rest of your life. But yeah, getting back to Gooby said that the results from going low fat or just going plant-based with no sodium and walking were as good as what he could do from surgery in most cases. And he's like, what the hell am I doing? Am I just, going through the motions to make money?
Yeah. Yeah. That's kind of what I got, was like he had a conscience crisis, even though, and he just quit. He said he saved his money and he quit, but which I thought was interesting because, I've had back issues over the years, and actually I solved most of them, but it wasn't until that. And now I want to hear about your books. Actually, what are the titles of your books? Do you have
Well,
those?
the most recent one was ischemic spine is the most common cause of back pain. So ischemia is just, lack of oxygen delivery to the tissue. And that was my experience because I look at tons and tons of spines. One of the things I do is I'm a neuroradiologist. I used to run a spinal injection clinic. I almost became an interventional neuroradiologist, doing all the procedures. But I do a lot of spine cases, tons of biopsies, epidural steroids, selective nerve root blocks, all of that stuff. I even used to have an acupuncture clinic. But I don't do that anymore. But I know a lot about the spine. I've run spine conferences and taught about them for many, many, many years. Okay, so anyways, what I'm trying to say is the main thing, everybody's always thinking, get an MRI of the spine, see if you have a disc herniation. But that's hardly ever what I see. I see that, 1 out of 50 cases do I see a disc herniation that needs to go to the OR, if that much. What do I see on the majority of cases? Degenerative disc disease from ischemic disease where the disc space is damaged. The normal disc is like a jelly donut. The center of it's called nucleus pulposus with the jelly inside of it, so to speak. The outer part's like a steel-belted radial tire, the annulus fibrosus, okay? When you have a lack of blood flow, the annulus fibrosus will crack. The nucleus pulposus will then leak. You can have a disc herniation, or it can just dry out and then lose height. It's called a desiccated disc. Okay, so how do you want it to work? Take good care of it. Eat the good diet, low-fat, low-sodium, vegan diet, whole food, no oil. Try to get your walking in every day, get some type of exercise, because that gets the muscles moving, increases the nitric oxide, so it gets more blood flow to the spine. And you get your glucose in there for the disc. You rinse away your waste products, and you have a happy spine. Also, you'll optimize your body weight, so you're not carrying so much weight, and you'll have a less compressive effect on your spine. Your foramina will be more open. You'll have less fat pushing on things. You can accumulate fat in your spinal canal.
So I guess you've seen that in the images. Is the average person who has back pain got some weight to lose? Is that part of most of these
they
issues?
do, but you don't have to be fat to have back pain, but a lot of them are fat. Most people who eat a Western diet, their BMI is higher than it should be. When you eat low-fat vegan, your BMI usually goes to normal.
Okay. But we got to be real specific. Like you said, low-fat vegan. It can't be junk food, can't be high-fat, even if it's 100% vegan, because you're going to run into these same issues, right? Even if you're
right. Yeah, all that processed vegan stuff is not good. I would never eat soy burgers or any of this crap. I would never eat any of that stuff.
Yeah, so
I would never drink soy milk, all that stuff.
Yeah, they're more disease promoting. And I know it's hard for people to understand. You think, well, it's plant-based. It's got to be better. But like you just said, if it's high fat, if it's processed, it almost certainly is. And if it's got added sodium, and it definitely does, right? You're going to be hurting yourself with every bite, it sounds like.
Yeah, I'm not a believer in any of these high-fat foods. I think nuts are a bad idea. They're 70 to 90% fat. They're also high in advanced glycation end products. They're sometimes a little bit high in their acid load. I think all this stuff about nuts being a good food and seeds is just corporate sponsored bogus advertising type research,
Yeah.
I don't like nuts. I don't like seeds. I would never eat avocados. I would never eat anything with more than one ingredient.
Yeah. Yep. Okay. So yeah, you gotta be careful. Now, going back to the back pain, I want to kind of get your final thoughts on this. So, is added salt a critical component that people should look at if they're experiencing back pain? And the reason why I'm asking is because most people that have back pain, they say, "Oh, I point it back to a certain thing that I did." It never sounds severe, okay? But it's just like, "Oh, yeah, it's always been a problem. I've done something, I can't do something, I'm limited." But they never bring up salt, right? And I never even thought about it till the last year, but now I'm thinking about it on a regular basis.
Yeah, my attitude would be you want to try to get a complete cure. And you might not get it, but you should go for it. And if you go for it, you say, well, what can I do to increase my odds of getting better? And avoiding salt would be one of those things. It's sort of like you got nothing to lose, you got something to gain. Why not give it a try? Um,
Yeah. Yeah, I would agree with that. It's just that even for me, it being in this space of health span longevity, I didn't really make that connection between. Of course, you and I weren't even doing interviews about a year ago. It's only been a little more recent than that. I didn't make that connection between added salt and harming your back, creating issues in the back. And I think still most people don't understand that. When I tell it to them that there's probably a connection there, they are like, "What are you talking about?" They can't see that would in any way cause it. But obviously, you've been writing about this for years, I'm guessing, right? With the
Yeah,
books
I,
that you've
I can
had.
answer the question. Why would sodium contribute to back pain? Number one, it's a vasoconstrictor. It causes your arteries to narrow. So you're going to get less blood supply to your spine. And less blood supply to the spine means less blood supply to the disc, less blood supply to the nerve. The disc is innervated, the sinovertebral nerve. So you can often improve symptoms in a neuropathy by improving blood supply to the nervous tissue. Okay. So it's beneficial for that sense. And salt does other bad things. Excessive dietary salt, it activates platelets, so it makes you slightly more prothrombotic, increasing your risk of a clotting event, which you don't want. It can sort of activate your immune system a little bit, increase your risk of things like asthma. It makes your platelets more sticky, like I was just saying. And not only does it increase your risk of a clotting event, it has a small increased risk of cancer too, because it can hide metastasizing cells in the blood by forming little platelet clots around them so the immune system can't find them. Everything in the immune system is by Braille. So it has those negative effects, a slight increased risk of cancer. It's small, but it's there. So you don't gain anything by it, except I know it tastes good, and maybe there's some food that you think is good for you and you wouldn't otherwise eat it. Okay, but like I said, make sure you get more plant foods to compensate for it. And I don't add salt to anything. The other thing is you got to be careful with your salt. A lot of them, if you look at them closely, they'll have an anti-caking agent in it or something that might be like aluminum, which is a brain toxin. You don't want that. A lot of
Well,
salts
what about?
contain plastic in them. They got
Oh,
microplastics in them, maybe because they come from the ocean and the purifying process traps plastic in there. So you're potentially eating plastic. I don't like
that's not
that.
good. No, no. Well, what about people that say, I eat pink Himalayan salt for the minerals, right?
I think that's a joke. You get your minerals from your food. You don't need to get them from your salt. Some people might
Correct.
say, well, I have iodized salt. Well, to the extent you could know, it used to be if you're only eating locally and you live in a goiter belt where the iodine's low in your salt, you're at increased risk for a goiter, but, enlargement in your thyroid. But if you live, nowadays we eat from all over the place at the grocery store. So there's probably going to
Yeah.
be a reasonable amount of iodine in some of it. So you can check your thyroid function test, but it's much less likely that that's going to be your thyroid problem. People have thyroid problems much more often because they got leaky gut, things like Hashimoto's thyroiditis. So
So there's bigger things that you see more often that create that than anything to do with iodine.
yeah, I think there's always somebody who sells iodine is always trying to say iodine deficiency is common. They're always trying to sell something. In order to sell something, they got to convince the person who they're trying to get to buy stuff that they've got a deficiency. So that's why you hear all this overhyping. Oh, you're deficient in omega 3s. You're deficient in, whatever it is, iodine.
All right, now, Dr. Rodgers, the iodine that's in salt, they say it's iodized. So does that mean they're adding iodine like a supplement to
Yeah, I
to the
think so.
salt?
I don't actually know exactly how they do it because I'm not interested in the subject because I know it's a non-issue for me.
Yeah.
Um, and I haven't seen it be that much a problem in my own personal experience. But you know, that's not something I deal with that often.
Right. Okay. All right. Something we do deal with often, I'd say, as I mentioned at the beginning of this video, I just had dinner. I put some hot sauce on, no added salt. How about all the condiments? Condiments, sauces, dressings, everything has added salt all over the place. Some people say, "Oh, don't worry about it. It's just a condiment." But for me, I mean, I cannot eat that stuff. I feel different afterwards. What are your thoughts on those?
Well, I would never eat anything that's a powder because they often put heavy metals in powders, like a lot of these different turmeric and all this other stuff. If I was going to have some type of spice or something, I would get like the little twig or branch or leaf or whatever it is. I would not eat the powder because a lot of times they add heavy metals to these powders to make them weigh more so they can sell them for more money. So I think that's a bad idea, number one. Number two, you kind of have a philosophy of eating. My personal philosophy is I'm a super busy guy. I work full-time in clinical medicine, and in my little bit of free time, I like to make some videos, write some books, spend some time with my girlfriend, spend some time with my family, okay? And that's about it. That's about all I do. So I don't waste any time. And what that means is when I eat a meal, I just want to get it over with. If my girlfriend cooks for me, she can do whatever she wants and make it taste better. But I just want to eat and get it over with, and I want to get back to work. So I know a lot of people aren't like that. They want to try this, and all this stuff. That's nice. They're welcome to do it. But again, I would get the real leaf, the real twig, or whatever it comes from. I wouldn't eat powder.
Yeah. Well, what about the already prepared condiments like ketchup, mustard, salad dressings? They're in these bottles or liquid, but they all have added salt. Like it's nearly impossible to find something without.
I would never eat any of that stuff. It's usually multiple ingredients. I only eat single ingredient foods. Most of these salad dressings are going to have oil in them. I think that's for wussies. Okay. I'm a very stuck up guy. I'm a bit of an elitist. Okay. I think I'm the best doctor in the whole world. I always have the highest standards for myself. What is the best I could do? That is what I will do. I don't have this attitude where I'm going to, because also all I see all day long are train wrecks. And I don't want to end up like that. I want to do everything I can to not end up like these train wrecks. And so for me, it's no big deal. I know real sickness and it's bad and you don't want it. And so it's wise to do everything you can to avoid it because there's going to be some things you can't avoid that you get exposed to inadvertently. So everything you can control, I would control. And some people will say to me things like, well, you're missing out on life. How could you say, at the party, the wedding, the work party, whatever, how could you not have some cake? You're missing out on life. You don't know what you're missing. And I'm like, I like being skinny and smart. My girlfriend's 20 years younger than me. She's a super foxy babe. I like it. I enjoy it very much. I don't want to be fat, sick, and stupid. Okay. Is that enjoying life to be fat, sick, and stupid? My pleasure comes from areas other than I like my food very much. I don't need to eat junk food to be happy in life. Okay. I just don't need it.
Yeah, I would tend to agree with that. I have a similar feeling, and you have the right motivation. You see all these sick people, so you have the right motivation. I wish everybody had that motivation and could see that, and then you talk about, not having fun. I would agree. I mean, I feel like our secret mission is to have fun. And if you are compromised in your health, you're limiting yourself. You can't do all the things you want to do, and it's all because you want your taste buds to feel a certain way 3 times a day. It doesn't compute. It doesn't make sense to me.
Yeah. Moment on the lips, forever on the hips, and you pay a price. It's almost like taking a flavoring medication or something. There's side effects. All those processed foods, they mess up your ionic gradients in your cells. They make you fat. The more processed food a population eats, the fatter they are, the sicker they are. I don't want anything to do with that.
Some folks call the processed foods, including the plant-based, right, including the vegan processed foods, like denatured drugs. Do you think that would be a good description of what's out there?
Yeah, they're bad. They're basically like a trick, okay? To me, it's like, an HIV positive prostitute on the corner, okay? She might look good for a moment, but, you're going to pay a price to take that ride, okay? It's sort of like, why do something that's bad for you? I look at life a little bit like Super Mario Brothers, a video game, okay? You do the good stuff, you get energy points, you win. You do the bad stuff, you lose energy points. You're weak, you're in pain, you suffer. And you hit points. You also hit what I would call like tipping points, where you have irreversible damage. You form a clot in your heart, you have a heart attack. That's irreversible damage to your cardiac muscle. When you destroy your spine, you lose your brain cells. And You don't want to go there. And so the wise thing is, fear of God is the beginning of wisdom. I say fear of sickness is the beginning of healthy nutrition. All you got to do is eat this whole food, plant-based diet, and you don't plug up your arteries. What more do you want, And if that's not good enough for you, then I'm sorry, you're an idiot, okay? There's nothing I could do for you. That's why everybody's sick, because their arteries are plugged up.
Dr. Rodgers, you mentioned irreversible damage to your spine. You had mentioned that earlier. I want to ask you about that. What do you mean by that? Like, how would someone know they're approaching that? How would they know they've arrived at this irreversible damage? What is that?
Okay, what I'm basically saying is, the more chronic and severe the lack of blood flow to your spine, plus all these other bad things we talked about, the more your discs just start collapsing, and you lose all your disc space height, and then you form all these bone spurs. The bone spurs give you foraminal stenosis, central spinal stenosis, and you're much more likely to have chronic back pain. You can still make things as good as possible with this low-fat vegan stuff and walking a lot, getting your sleep, avoiding caffeine and stress and sleep deprivation. You do the best you can. But what I'm saying is, the more discs you destroy in your spine, the more bone spurs, osteophytes we call them, that you have, the more likely you are going to have chronic back pain. The more likely you're going to walk hunched over like one of these little old people with their walkers. Okay, I see tons of these old guys with their walkers. And then they get a point where they can't even walk with a walker. They get a scooter. Okay, my internal medicine friends tell me, usually when they get that scooter, they're dead in 2 years or less. Quite often, he says, quite a few of them, they're dead within 1 year once they ask for that scooter. So, you don't want to end up like that. I'm 61. I don't have any medical problems. I don't take any pills. I got a lot of energy. I do a lot of things, and I enjoy my life. That's what I want to do. And you have to maintain your health to be like that, because otherwise, most people don't maintain their health. The old saying is most men dig their own grave with a fork and a knife. And I'm listening to an interesting book in the car. I'm listening to Ayn Rand book. It's called The Return of the Primitive. And there was one little section in there where she talks about philosophy. She says, a man needs philosophy. He needs to develop the ability to recognize the truth. Because if he can't recognize the truth, he'll be making his decisions based on false information. And when he makes his decisions based on false information, he becomes his own destroyer. And I think that's what most people do. Life's tough enough as it is if you're careful, you're hardworking, and you're intelligent about how you behave. But if you're stupid and you plug up your arteries for no reason with this junk food and stuff, you're going to suffer a lot. And I see real suffering, tons of strokes every day. All these people that have advanced cardiac disease, advanced degenerative spine disease, all kinds of problems, okay? And the level of impotence is off the charts. It's like every single patient practically is pre-diabetic or diabetic, middle-aged and older, pre-diabetic or diabetic, hypertensive. Those are the gateway diseases that goes into atherosclerosis. They're plugging up arteries, their brain, their heart, everywhere else, and they're not doing well, okay? And then they hit a tipping point where they're just too sort of mentally slow to ever get their act together, and then they just take all their pills, they go for the surgery, and basically, to me, you're getting drugged and chopped up, processed like a dumb animal. If that's what you want, go ahead. But that's not a wise.
And I would say, just in case there's some new viewers out here who don't realize why this is the case, if you think about it, none of the behavior that Dr. Rodgers described in terms of personal choices is illegal. Okay, it's all in many ways you're patted on the back because so many other folks are doing it as well. And then when you get to the medical side, the folks that are being seen, the patients seeing their physicians, they're concerned about the standard of care, which is not the same as optimal care. Is that correct?
Yeah, the standard of care, you have to remember, everything in medicine is based on the assumption that the patient is a moron, okay? And it kind of has to be that way because a lot of patients are mentally slow, demented, cognitively impaired, or they're intoxicated, they're drug addicts, they got real problems. So standard of care is what a doctor is obligated to do. And it usually is match the ill to the pill and send a bill. Patient comes into your emergency room, your office, whatever. You say, okay, you've got back pain. Let's get an MRI. Let's get a CAT scan. Let's put you on these medications. We'll send you to the pain management clinic. They'll give you an epidural steroid injection. If that doesn't work and we see anything on your MRI, we'll send you for surgery. That's kind of like a typical thing. It's very unlikely you're going to hear them say, well, they told me to go low-fat vegan, no oil. Because if they did that, number one, it would take time to teach and coach the patient. They don't have time. They get paid the number. Every hospital, every clinic has a bean counter. And the bean counter wants money. And the way you make money is you generate more billing codes as fast as possible. And the bean counter at every clinic and hospital typically talks to the doctors every couple of months and says, look, the hospital across town is generating more billing codes than you are. Why are you guys so lazy? You're going to have to be more productive, or we're going to let you go, or we're going to cut your salary or something. So the doctor has to obey the bean counter because that controls their salary and their job. And then they have to please the insurance company. The insurance company says, well, to get paid for a code number XYZ, you've got to do all these things. So the doctor knows they have to go as fast as possible so they can see 30 patients in one day, and they got to hit all the correct spots to get the billing codes to get their insurance money. And they don't want to get sued, so they got to follow the standard of care, and the standard of care is based on the idea that the patient's an absolute moron, can't do anything for themselves. So everything is based on that, all right? And then even if the doctor knew what to give you as advice, they don't really have the time to do it. Okay, and I can also tell you, I know lots of doctors. The doctors don't know how to take care of themselves, okay? I know docs that are the top of the line in terms of their knowledge of the medical books. But the reality is the information you need is not in the medical books. The medical books do not include nutrition, epidemiology, toxicology, okay, and health optimization. They include standard of care and something called GDDT, goal-directed drug therapy, okay, knowing the protocols, the algorithms to give drugs. So it's sort of like I said, it reminds me of Dante and Virgil before the gates of hell, where it says, abandon hope, all ye who enter. They don't expect to cure you. They've been trained that this is a chronic problem, and you're never going to be cured unless God cures you, okay, with your back pain, okay? What they try to do, in a sense, it's like the Voltaire quote, the doctor amuses the patient while nature heals him. They try to just keep you busy for a while with some different pain pills, with some epidural steroids, with the hope that you heal on your own. You get it? And why not accelerate your healing on your own? Eat the low-fat vegan diet with no oil so you optimize your body weight, you improve your blood flow, and hopefully it'll heal on its own. You avoid the sodium so you have open arteries. You walk a little bit so the nitric oxide is increased when the muscles are active, and you get more blood flow to that spine. That's what you want to do. And you can start gradually reversing whatever baseline atherosclerosis you have with this healthy diet and lifestyle. That's the smart thing to do.
Right. Well, I hope your words inspire some folks out there. And if you already know this, I mean, what I want to do is put together a comprehensive video about added salt, because so many people think, oh, it's just a small detail. But as you can see from listening and watching this video, it has a lot of negative consequences. And that back pain, that spine damage is so critical. I wish more people knew about it. So share this video with other people. Now, I wanted to ask about a little hack here, Dr. Rodgers. You hear, at least I hear, that certain whole plants are higher in sodium. And now, like celery, is that an acceptable thing that people can maybe add a little bit to their dish? Is that because it's got the fiber and the water and the nutrition with it? What do you think?
Well, I don't know the exact number for celery, but I kind of smiled because celery became a little famous. There was this guy on the internet. I don't remember his exact name. He calls himself something like the mystery medium or something, the health medium or something. And he tells everybody to drink celery juice. So I don't know how good it is or not. I certainly know one gimmick food isn't going to fix all your problems, but it's probably not that bad of a K factor, a ratio of potassium to sodium, because it's a plant food. The vegetables tended to have the lowest K factors, but it's probably not that bad because it is a plant food. I would certainly, get it organic. But yeah, I don't know that much specifically about celery. If you're eating plants in general, you're going to have a high K factor. My K factor, it's probably, close to 20.
Yeah. And of course, it's imbalanced. It's in nature. It's a whole food. So it's going to be better, right? Because one of the things I say to folks too about most forms of added sodium is, for the most part, it's an isolate, right? It has water removed, no fiber. Most of the other nutrition is gone. And so it's out of balance. And I always like to tell people that life is about balance, just as you've described here in this video. The minute you throw that sodium out of balance from its natural state and you put it in your body, it's going to create some negative side effects. I think a lot more negative side effects than most people realize. And, really appreciate you taking the time to explain all this to us.
Yeah, I would want to just avoid any processed food. There's a good thing for people to look up. They can look up Nauru. It's like Nauru, Nauru. It's a name of an island. I don't know exactly where it is, somewhere in the Pacific, I think, near, I don't know if it's near Papua New Guinea or Australia or something. But anyways, here's why it's interesting. they had a lot of tropical birds, and the tropical birds would defecate all over their island. And there's a lot of phosphate in the tropical bird defecation. Okay. So some big companies came up to the people of the island and they said, you know what? We'll give you good money for this fertilizer. We're going to take this phosphate bird poop and use it as fertilizer. Okay. So the people used to grow all their food, all their own food, and they're very healthy and skinny. And the corporations offered them tons of money, big cash. So the people in Nauru said, okay, we'll make a deal with you. And they were for a while known as the richest island, the richest country in the world, Nauru. But they sort of strip mined all of the topsoil for growing food, and then they shipped in all this processed food. And the Nauru people who used to all be skinny and healthy, now they're the fattest people in the world. The average body weight for an adult was 230 pounds. Okay, and they're eating processed food, and they sold all their topsoil, so now they can't grow their own food. They kind of screwed themselves like a bunch of idiots. So you can look them up. You can look them up on Wikipedia, Nauru. And what I'm trying to say is these Americans, you know what works. It's been studied long enough. We now know that's what makes people healthy. That's what prevents all the common Western diseases. There's a low fat, low sodium, starch, plant-based diet. Okay, with no oil. So you know what to do. And if you're not sure, try it for a couple months, see what happens to your lipids and your body weight. Give yourself a chance. I can tell you, I've studied all this stuff in a lot of detail for many, many years. As far as I'm aware, this is the only diet that can reverse coronary artery disease. It's what humans are made to eat to optimize their health. And it's like, why wouldn't you do it?
And the degree to which you're compliant to what you're saying is the degree to which you're going to see benefits for your health, right? So that's motivation, I hope, for people to know that if you take this seriously, like you were saying, Dr. Rodgers, you should. You only have one life to on this earth that we know of. You might as well make the best of it, right? And not be the one that's responsible for your own demise, especially when this knowledge is out here. Because I would understand if this knowledge wasn't here, but I so much appreciate you taking the time to speak the truth to us, and to get this knowledge out there to the folks that are receptive to it. And like I said, this back pain thing, I think if word can get out to more people about that connection between added sodium and chronic back pain, I think that a lot of people would rethink their stuff. I know there's a lot of factors in back pain, but that's new to me, like I said, in the last year. So I appreciate you doing the pioneering work too on putting books together, which I'm going to start looking for. Maybe after the show here, or I'll put a link down below for those links.
I've also got videos. Oh, excuse me. I've got videos at my YouTube channel if they want to watch my video about back pain.
Okay, yeah, I'll link that down below to your YouTube channel. So yeah, I mean, I think we pretty much covered everything, and it's like you said, you have the right motivation. You see the images. You're practicing radiology. You see the images, so you know what's happening to the average Joe and the average Jane. And I think that, if everybody else could have that information, I think they'd be a lot more motivated. And I am an optimist, so I hope that, because you're taking the time to make this video, that you are going to positively impact future generations. I mean, I do believe we will see improvement, and I agree that's going to take some time. But, at least we're in a spot where, you can see that just from us having a conversation here and other people watching it, that you're going to positively impact at least a few people at the very least.
I figure you give people a chance. I view myself like a lighthouse. It's like, hey, here's the information. You can take it or leave it, pal. And, one thing I would say too is the human body, it's good to think of the metaphor of being like a car. If you buy a sports car and it's supposed to last you, let's say 90 years, you got to take good care of it. So if you only get one car, you can't replace it. And you got to make it last. Well, it'd be wise to put the proper fuel into it, because if you don't put the proper fuel in it, there's no medical surgical bullshitology that's going to change that. So there's no way around it. There is no pill.
I like that. I like the metaphor because I'm a kind of a car guy, and I know about that. And I would say to people, here's how I approach the average person. I would say, think of the most reliable car you can imagine, right? Now think of you, the owner, flooring it everywhere and never doing any maintenance on it. Do you think it's going to be real reliable, even though the average version of that one is? And I think everybody knows the answer is no. You abuse something like that, it's going to severely affect the longevity. So yeah, I think. And do you happen to have any graphics for us this time? I know we're
I
just about
could
at the
show a
hour
couple
here.
slides if you want. I have a little slideshow if you want.
Yeah, absolutely. We'd love to see some visual components.
Okay, I'll show a couple slides here. Um, all
Let me
right,
know if
let
you're
me.
able to share.
I got to share my screen. Let me share my
Yep,
screen. Okay, I'm clicking the share screen button. Entire screen. Allow. Okay,
there we
now let
go.
me go to. I'll go to the talk. Here's the talk. Can you see it?
Yes.
Okay, so the first picture is just to show you that red blood cells are also called erythrocytes. They're usually about 7 microns in diameter. You want to remember that number. White blood cells like neutrophils, typically that's the most common white blood cell. It's about 65% of them. That's about 14. So let's make that 14 microns. It's very big. Capillaries are only 5 microns in diameter. So what I'm saying is even a red blood cell, which is over 99% of your cells, it has to fold back on itself to pass through a capillary. The reason you have a blood pressure is to pump blood to the top of your brain, your cerebral cortex, and it has to be pumped against gravity. That's what determines your blood pressure, what it takes to get blood to the top of your brain. So when you eat a high-fat meal, these little brown things here are fat sticking the red blood cells together. They make your blood thicker. It's called increasing blood viscosity. So normal blood, like water to pump to the top of your brain, when you have a high-fat meal, the red cells are stuck together. Now it becomes like a milkshake. You have to pump thicker fluid, so pressure has to go up. That's the main cause of high blood pressure is these high-fat meals. You also get more inflammation in general when you eat processed diets and meat diets. They're more likely to cause leaky gut, which means you'll elevate your white blood cell count. And that's why the size of these neutrophils is relevant, because you're going to have to push more of these big cells through your capillaries. Pressure has to go up. Okay, the next thing is the diameter of these arteries. When you eat sodium, it's going to inhibit the vasodilator, the endothelial nitric oxide. So you're going to get vasoconstricted arteries, narrowed arteries. So now you see the dilemma. You're pumping thick blood through a constricted system. Pressure has to go up. So right there is the hypertensive effect of sodium and of high-fat diets. Plus, on top of that, inflammation from the meat diets. And all these things make you have to pump at a higher pressure. Okay, because you get more leaky gut, you get all kinds of issues with increased blood viscosity, thickening, and inflammation. Things like xenocellulitis, TMAO, elevated LDL cholesterol. You're going to get something called amyloid clotting. A link between white blood cell count and blood pressure levels. Yeah, the higher your WBC count, people who eat meat and processed food have higher white blood cell counts than do vegans.
Okay.
The higher the LDL cholesterol, the higher your blood viscosity, the thicker your blood. The reason is normal red blood cells have a zeta potential, a negative charge around their outer surface. And that's a good thing. All the red blood cells have it. All the endothelial arterial lining cells have it. The white blood cells have it. They all have this negative charge called the zeta potential. So they all repel each other. And that's exactly what you want to prevent clotting. There's some things that will have a positive charge and are big enough in size that they can overcome the zeta potential, like an IgM antibody in an acute infection, fibrinogen, the clotting protein, uric acid can do that as well. And like I said, LDL cholesterol, triglycerides will do it, chylomicrons will do it. Polyunsaturated fats will also have this effect. This is an experiment done by Peter Kohl back in 1955. He took cardiac angina patients, people with episodes of chest pain due to coronary artery atherosclerotic narrowing. When he fed them a high-fat diet, he checked their blood lipids every 30 minutes. When they were at peak lipemia, usually between about 4 to 7 hours, they would get episodes of chest pain, and it corresponded to the peak lipemia. They repeated the same studies with unsaturated fat, PUFAs, polyunsaturated fats, omega-6 cooking oils, and they also got the same thing, chest pain, drop in oxygen delivery to tissues. If you feed them carbohydrates like this green line down here, like a starch, they don't get any of this stuff at all, none of it. So you're predisposing yourself to heart attack by eating those high-fat foods. They make your blood more prone to clot. Atherosclerosis is a blood clot. High-fat diets increase the tendency of blood to clot. You don't want to eat them.
Mm.
Okay. There's also something called myeloperoxidase. The high-fat diets cause some inflammation. They cause some activation in neutrophils, meaning that the neutrophil becomes concerned that there's something abnormal going on. The neutrophils will have a tendency to release their granules. That's called degranulation. And they contain something typically called MPO, myeloperoxidase. The myeloperoxidase exits the neutrophil, and it binds to the arterial wall, the endothelial cell. This is called a glycocalyx. These little cells sticking up are the glycocalyx proteins, and they have little side chains attached to them. So the blue right here, the dark blue, is the core protein called the syndican. The little alternating light blue dots are called heparan sulfate. It's also called glycosaminoglycans. All you need to know is it's negatively charged, and therefore it repels the red blood cells traveling through, which is exactly what you want. But if the neutrophil degranulates because of inflammation due to leaky gut, the MPO is very cationic, very positively charged. It'll interact with the glycocalyx and cause it to collapse down. Normal glycocalyx is tall. It's about 600 nanometers in height. These binding proteins like VCAM, vascular cell adhesion molecule, they're only about 60 nanometers. But so you don't normally ever see them if you're a red blood cell traveling through the capillary. But once the glycocalyx collapses down, like this right here by the MPO, myeloperoxidase, now these VCAMs, adhesion molecules, are exposed, and red cells and white blood cells and other things can bind to them, and that'll then cause clots. It'll cause inflammation. They'll start to release chemicals that can open up the tight junctions between the endothelial cells, travel into subendothelial space. You get all kinds of problems, is what I'm saying. And what's the smart way to avoid that? Eat your low-fat, plant-based diets. Okay. Yeah, you're not going to win with fat. The problems with fat aren't 1 or 2 or 3. They're about 30, okay? You just
Dr.
can't win
Rodgers,
with that.
how about does anything specific to added sodium here, along with what you're explaining?
Yeah, well, so I'll come to that. Sodium's a vasoconstrictor. Here, I'll start coming to that. You also will tend to get leaky gut, and then you'll get bacterial endotoxins in the blood. They're prothrombotic. If you eat processed foods or you eat meat, you become iron overloaded. All of that is also going to end up causing more clotting in the blood, making it prothrombotic. Okay, it can distort the shape of your red blood cells as well. I'm gonna get to sodium in just a moment with these slides, but another thing that happens in processed food, the companies have a lot of research. A lot of these food companies have billion-dollar budgets. They test how much salt do they need to put in there to make the person like it, how much glutamate, monosodium glutamate, manufacturer-free glutamate, how much high fructose corn syrup, other things for texture and mouthfeel. So they hit what's called a bliss point, where the test audience is most addicted to the food. So that's why they make things like Jay's Potato Says. I bet you can't just have one. Because, yeah, it does taste good, but it's a transient pleasure. They'll also grind up a protein and separate out the individual glutamate units, because the more they free them up, that's called MFG, manufacturer-free glutamate, the better the food will taste. And they can take a stale food product and put all these flavorants on there, and it'll taste good. So you can be eating really lousy, old, stale, crappy food and think it tastes good because of the MSG. Okay, so here's your gut under normal circumstances. It's a single cell thick. The dietary fiber is a really big thing that protects you. The good gut bacteria here have smiley faces. They take the dietary fiber and they convert it into a 4-carbon butyrate, which is a short-chain fatty acid. And that goes into the gut lining cells, the epithelial cells of the gut. They're called enterocytes because the gut's called the enteric tract. And they make these TJs, tight junctions. And this protects anything bad from getting across your gut wall. But if you don't eat your dietary fiber, then you can't make your tight junctions, and you'll have leaky gut, which means increased intestinal permeability. All of these things listed here are toxic chemicals that also increase the risk of injury to the gut wall and developing leaky gut. When that happens, you can get these bacterial endotoxins like LPS, that means lipopolysaccharide, getting across the gut wall into the blood, and they make it more prone to clotting, which is bad because that means they increase your risk of heart attack and stroke and other problems. Normal blood, you can see through the plasma. It's relatively translucent. When you eat a high-fat meal, it makes the plasma relatively opaque. We talked about this, rouleau formation, like a stack of coins when you eat the high-fat meals. You drop the oxygen delivery to the brain tissue also with these high-fat meals by, anywhere from 15 to 30%. Oh, that's all the slides I got. I guess I didn't have my sodium slides in there. Oh, I'm sorry about that. I can tell you, though, it comes down to the plasma membrane. If you want to give me a sec, I could find them real fast.
Yeah, of course.
That's pretty easy for me to do.
Well, I can say also, add my little 2 cents here, that, yeah, I mean, there's no question that high fat part, because you and I did an interview on that a month ago, 2 months ago, something like that. And we're discussing exactly why that causes negative health consequences. And like you said, that leaky gut, I mean, that leads to so many other things going on. Once you enter that paradigm, it's not good. Yeah, you have quite a few files there.
Oh yeah, I've got like 5,000 videos. Let's see here. I can usually categorize them by size. That gives me a better idea how much is in
Oh,
them.
one thing also I wanted to mention to people while you're looking for this, something I've heard, and you can comment on this, Dr. Rodgers, when you get a moment. But you hear on the street, well, how much salt total in your diet per day is okay? What I've heard is 1,500 milligrams. That's usually what people will say, and that's not a lot. And I'd say the average person is probably 2 to 3 times that at a minimum every single day. And then people will say, well, what is if you think 1,500 milligrams is a lot, what do you think? Now, I've heard maybe half that, which is about 750 milligrams is optimal. And of course, if people can't even maintain 1,500, they're definitely not going to maintain 750. But what I think what you realize is that in order to maintain a maximum of 750 milligrams of total sodium in your diet every day, the only way to do that reliably is to eat almost exclusively whole plant foods. Because if you do that, I think that's the only way you can achieve that, because you don't want too little. You don't want less than that. I think that also causes problems, but almost nobody has that situation. But as long as you're eating whole plants, you're going to get that 750 and I think be optimal. I don't know if you've heard that, Dr. Rodgers, or what your thoughts are
Yeah,
on
I
those.
mean, it's if you want to be as healthy as you can be, that's the way to go. Low fat, low sodium, single ingredient foods only, whole foods, and no oil. I mean, that's the magic formula. That's what's been figured out by the last 100 years of
Mm-hmm.
nutrition experience, epidemiology, and research. There's a lot of people that'll tell you otherwise because there's no money in it. Imagine if the majority of the American public became healthy. The hospitals would lose money,
Yeah.
doctors would lose money, the whole system, the pharmacies would lose money. They don't want that. They need everybody to be fat, sick, and stupid to make the most amount of money off them. So that's what gets pushed. I jokingly call the Mediterranean diet the Antichrist diet, okay, because it
Mm.
makes people fat and sick. I'll show you a
Yeah.
little bit more about how cellular physiology works. Here's an endothelial cell, meaning the lining cells of arteries. And the most important thing to know about it is it makes nitric oxide. Nitric oxide is a gas, and it will travel into the lumen of the artery, and it'll interact with the platelets and prevent them from clotting. Okay, it'll travel into the wall of the artery and go to the vascular smooth muscle cells and get them to vasodilate. So it'll open up the arteries. And that's the important thing to know. Sodium, inhibits the production of nitric oxide. So you're going to have blood more prone to clotting, and you're going to not be able to relax the vascular smooth muscles. So your arteries are going to be narrowed. So that's a big negative for sodium. The next thing has to do with electrochemical gradients. So now we're inside of a cell. This is a neuron, but it could be any cell. All cells have a lot of these potassium-sodium pumps. Sometimes it's called sodium-potassium ATPase because it uses ATP. Adenosine triphosphate goes to adenosine diphosphate. And the energy given off by releasing that phosphate powers the pump. They pull in 2 potassium, so a positive charge of 2, but they pump out a positive charge of 3 sodiums. Okay, so the net effect is more positive charge going out. That leads to a negative charge inside the cell, negative 65 millivolts. Okay, it's really like an electrical battery. We call it the sodium battery. The concentration of sodium outside the cell is 10 times higher than the concentration of sodium inside the cell. And that's why I jokingly call sodium the angry poor. It wants to bust into the cell, both because it's attracted to the negative charge inside the cell, that's the electrical gradient, and because it has a chemical concentration gradient for itself of 10 to 1, 10 times higher out here than inside. And it wants to equilibrate that gradient. Okay, so what the cell does is it couples the energetic entry of sodium into the cell with the pumping of calcium out of the cell. This is called the NACA exchanger. Na means natrium, is the word for sodium in Latin. Ca is for calcium. X is for exchanger. So it's like a rotating door in a big hotel or something, big business building or something. And when the sodium comes in, it spins this like a mill wheel, and then that ejects the calcium out of the cell. And you have to do that because calcium is activating the cell to do whatever it does. A brain cell to release its neurotransmitter, a muscle cell to contract, a pancreas cell to release insulin. Whatever the cell does, calcium makes it do it. So what I'm basically saying here is if you eat too much dietary sodium, you start to accumulate sodium inside the cell. Potassium and sodium are fixed in concentration inside the cell. They're about 98% of the cations, the positively charged ions in a cell. They must remain constant. They're always the same because you can't have more positive charges accumulating in a cell or you'd have an osmotic gradient to pull water into the cell. So you can't have that. And for that reason, if sodium comes into the cell more, which it does when you eat tons of sodium, then you're going to lose the amount of potassium you have in the cell and you're going to dissipate this gradient. There'll be a weaker chemical concentration gradient to bring sodium in. When you weaken that concentration gradient, you're less able to pump calcium out of the cell. So you're less able to turn the cell off. And as that relates to the vascular smooth muscle, they stay more tonically contracted, meaning that drives your pressure up, which is bad because then the hypertension starts damaging the arteries and you get into a vicious cycle. That's really what it's all about. So how do you win the game? The way you win the game is eat more plant foods so you get more potassium. Don't add, try to avoid high sodium foods and don't be adding extra sodium to your food or keep it to a minimum. And then you'll have a high K factor ratio of potassium to sodium, which is what your body's made to run on. You'll have good gradients. Your cells will function efficiently and your blood pressure will move towards optimum. Okay. So that's the most important thing, how it works. There's other little details. You get your magnesium. It's located in the center of chlorophyll from eating plants, That's really the big secret of hypertension. Avoid the high-fat foods. I think that's about all I got there.
Dr. Rodgers, how about one of the other questions that I've have for you that I've noted over the years is that people will sometimes take sodium pills to retain more water, like long-distance runners. Because I used to do long-distance running, and that's what some people used to do. Is that how it works? If you have a lot of excess sodium, you'll hold on to water weight on your body?
Well, if you're sweating a lot, that might help you a little bit, but I wouldn't, like if people drink an electrolyte solution, what I've heard is it's good to have a little bit of sodium in there, but you don't need much. There's something called a sodium glucose transporter in the gut to help you absorb more glucose. You're going to be losing some sodium in your sweat, but you really don't need too much. You've already got higher sodium in your blood. Your sweat glands are like little kidneys. What I've heard of these athletes, I've heard of two things. I've heard of some triathlete doctor friends of mine. They like Maurtens, Maurtens, as a electrolyte supplement. The other thing I've heard was like that guy Kipchoge, the world record holder in the marathon for a while. He ran a marathon in less than 2 hours. He said he would take a giant cup of iced tea and he put tons of sugar in it, okay? And he claimed he liked doing that. I don't ever want to put sugar in my food because it hurts my tooth. I got a cavity, okay? I don't ever want to do that. I tried it a couple of months ago, and it gave me the reactivated a cavity, which was a pain in the butt for me. I'm not a big fan of the sugar diet. I think you're going to rot your teeth. Some people are sensitive to rebound hypoglycemia.
Okay, well, you're also talking about things, or I'm talking about things too with athletes. The average person wants to park as close to the door as possible. They don't want to even sweat, So this is not going to do the average person any good. So I'm just bringing it up because I think maybe does the average person, if let's say they're not athletic, they're not really getting much sweating going on. Just the fact that the average person eats added sodium, will that cause them to retain extra
Well, a little bit of sodium is not that big of a deal. But what I'm basically trying to say is I gave these examples earlier. The Yanomamo, they don't add any salt to their food. These tribal populations out in the jungle where it's really hot in the Amazon jungle, they're only eating about 200 milligrams a day, okay? They're doing fine. And they're very athletic. They're kind of crazy and violent. They're constantly at war with the other local tribes, if you will. And that's what's a little bit funny is that despite all that stress, they're constantly, fighting each other, trying to steal each other's women. If you read about them, you'd be surprised. The Yanomami, okay? But despite all that, they don't have any hypertension.
That's right. Yeah. Well, that's the thing. They don't have any.
You don't need much sodium.
Yeah, they don't have any things that are going to hold them back from doing whatever they want, basically. That's kind of our message, right? We want people to be able to do what they want in their lives. And the only way you're going to be able to do all the things you want is to not harm yourself. And, that's what we've been talking about here in this video. And we very much appreciate your knowledge and insight, Dr. Rodgers. I hope that this video will get others, thinking or talking to people about why are we doing this added salt thing when it could have so many potential negative health consequences. But I'm an optimist. I think it'll improve over time, but it's going to take a long time. And just share this video. And Dr. Rodgers, I look forward, to speaking with you again next month on another topic. And by the way, if you're watching this and you have some general topics that you'd love to hear more about, just put it down below in the comments, and hopefully we can get to that soon in the near future. So that's all for me, I think. And thank you again, Dr. Rodgers, and I'll see you next month.
Thanks. My pleasure. My pleasure. Thanks.
You're welcome.